Hi, my name is Ravellino, and over the past 16 years, I've helped thousands of Americans with their Medicare options using this exact presentation. I hope you enjoy. So here we are with Medicare 101, Understanding Medicare. Today we're going to be going through what is Medicare, who is eligible for Medicare, the parts of Medicare, Medicare costs, enrolling in Medicare, Medicare options, Medicare supplements and Medicare Advantage plans, and Part D prescription drug coverage. On July 30th, 1965, President Lyndon Johnson signed Medicare into law. Medicare is a federal insurance program administered by the Centers for Medicare and Medicaid Services, or better known as CMS. CMS is an agency within the Department of Health and Human Services, HHS. Social Security offices process applications for Medicare and can also provide general information on the program. So who is eligible for Medicare? Well, individuals who are 65 or older, individuals who are under 65 and have received disability benefits for at least the last 24 months, anyone with end-stage renal disease or ESRD, and ALS. Here are the parts of Medicare. Medicare consists of 4 parts. There's Part A, which is hospital coverage, Part B, which is medical coverage, Part C, which is Medicare Advantage plans, and Part D, which is prescription drug coverage. Part A qualifications. Part A comes at no cost if you and your spouse have worked for 40 quarters and paid into FICA taxes for those 10 years. If your spouse has passed, you must have been married for at least 10 years to claim premium-free Part A under their work history. You must also be a U.S. citizen or a legal U.S. resident for at least 5 continuous years. Part A hospital inpatient costs without supplemental or Medicare Advantage coverage. For days 1 through 60, there is a $1,600 deductible that you would have to meet. That includes for just 1 day in the hospital. For days 61 through 90, is a $400 daily co-insurance payment. For days 90 through 150, it's an $800 per day co-insurance payment. For skilled nursing facility visits, for days 21 through 100, you'll have to meet a $200 co-insurance payment per day. Part B, medical/outpatient costs. Standard Part B premium in 2023 is $164.90 a month. The state may pay this premium for you if you qualify for the Medicare Savings Program based on your income. Higher incomes will result in higher premiums. Premiums can come out of your Social Security check or paid on a quarterly bill. Now take a look at this chart here below. On this chart, you can see what your Part B premium cost would be based off of how you file your taxes. If you're an individual and you make less than $97,000 per year, or if you file jointly and you make less than $194,000 a year together, you'll be paying $164.90 a month for your Part B premium. Take some time to look at the chart to see where you stand financially and what your Part B premium would cost. Enrolling in Medicare. Already withdrawing from Social Security? You will automatically be enrolled in Medicare when you turn 65. If you're not withdrawing from Social Security yet, you must apply for Medicare online at ssa.gov or over the phone with Social Security at 1-800-772-1213. If you sign up for Parts A and B when you're first eligible, you'll make sure you avoid the penalties. So when does my coverage start? Medicare will typically start on the first day of your birth month. I was born on January 19th. My Medicare will start on January 1st. If your birth date falls on the first day of the month, then your Medicare will begin on the first day of the month prior. So if you were born on January 1st, your Medicare will start on December the 1st. The IEP, or Initial Medicare Enrollment Period. This period starts 3 months before you turn 65 and ends 3 months after you turn 65. The coverage will start the month of your 65th birthday. What is AEP? The AEP is the annual election period This is a time when you can make a change to your coverage, which is October the 15th to December the 7th each year. You may switch to original Medicare if you'd like, change your Medicare Advantage MAPD plan, or stay enrolled in your current plan, or look for new coverage which would begin on January 1st. So let's talk about delaying your Part B. If you're covered through an employer with more than 20 employees, there is an option to delay your Part B, but please make sure that you consult with your benefits coordinator first. An SEP, or a special election period, exists to enroll into Part B anytime once your coverage ends. This SEP will last 8 months. Common Medicare plan choices. Some common choices that you have are Medicare, traditional Medicare, with a Part D plan, since Medicare does not cover prescription drug coverage. Medicare with a supplement plan. You also want to add a Part D coverage for that too as well, since Medicare and supplement plans do not cover Part D. Or a Medicare Advantage plan, which covers all the benefits of original Medicare, as well as most plans have Part D included. So let's talk a little bit more about Medicare supplement insurance. You can go to any hospital, doctor, or provider within the United States that accepts Medicare, and no referrals are necessary. These plans are standardized, meaning that the benefits will not change from company to company. You will pay a monthly premium for a Medicare supplement plan, and the average Medicare supplement plan G rate increases between 2% and 6% annually. The percentage can be higher or lower based on your carrier. It is important to understand the rate increase history for the carrier you choose. Here are the Medicare supplement plan options. As you can see, these plans are going to be standardized, always the same from carrier to carrier. Plans C and F are no longer available to those who are newly eligible for Medicare on or after January 1st, 2020. Part B premiums usually are $164.90. You'll have your Medicare supplement plan, which premiums vary depending on the plan and company you select. It pays 100% of your Medicare approved charges. You'll have to pay your Part B deductible of $226 a year. There's possible excess charges up to 15% with Plan N. Prescription drug plan premium, and those premiums may vary too as well depending on which Part D plan you select, and a possible prescription drug deductible that you will be responsible for. Let's talk a little bit about Part C, or Medicare Advantage plans. These are offered by private insurance companies. They include the benefits of Medicare Part A and Part B, as well as additional benefits not included with Medicare. They have low to no plan premiums. They do have networks, co-payments, co-insurance, and deductibles included, and protect you with limits on how much you can spend on your health services each year, some both in and out of network. That benefit is called a maximum out of pocket. Part C Medicare Advantage. Some of these plans include RX coverage, others do not. That is going to be an MAPD, which covers prescription drug coverage, or an MA only, meaning it does not cover prescription drugs. These are usually for veteran beneficiaries. Plans can also offer other benefits, such as dental, hearing, grocery cards, over-the-counter allowances, vision benefits, flex spending cards, gym memberships, and transportation. A beneficiary must be entitled to Part A and enrolled in Part B to be qualified for a Part C plan. The beneficiary must also live in the Medicare Advantage plan's service area or county. There is no medical underwriting required to be enrolled in a Medicare Part C plan. And the valid election periods are either going to be an SEP that occurs or happens, the AEP from October the 15th to December the 7th, or the IEP, which is the 7-month period of which you can enroll from your 65th birthday. So let's talk again about the initial enrollment period for Part C and D. The period when a beneficiary is newly eligible. The IEP begins 3 months prior to the beneficiary's 65th birthday, includes the month of their 65th birthday, and extends 3 months after their birthday month. An example would be Mr. Smith turned 65 on July 10th, 2023. He will become eligible for Medicare Part A and Part B beginning July 1st and has decided to enroll in a Part B for an effective date of July 1st. Mr. Smith's ICP begins April 1st, 2023 and ends October 31st, 2023. Beneficiaries can enroll in a standalone PDP or an MAPD plan. The effective date will be the month the Part A or Part B become effective. Health Maintenance Organization, or better known as HMO. Members of HMO plans are restricted to a list of network providers. Beneficiaries are subject to 100% of the cost out of network. These plans have very rich benefits in network. The HMO plans typically have lower co-payments, co-insurances, and maximum out-of-pockets. Some HMO plans even offer Part B givebacks to their members. Some HMOs offer a point-of-service option that allows enrollees to go to non-planned doctors, hospitals, with prior authorization may be required on those options. To summarize, an HMO plan has lower premiums, lower co-payments, lower maximum out-of-pockets, does have a smaller network involved with doctors and providers. Preferred Provider Organizations, or PPOs. These have larger networks than the HMO plan. You have the flexibility to use doctors in and out of network on some of these plans. They have a maximum out-of-pocket limit for in and out of network as well. They have a greater cost savings when you use your in-network physicians. You do not need a referral to see out-of-network providers. And regional PPOs are PPOs that serve an entire region made up of one or more states. Veterans have options as well. Medicare Part A only, and to use their VA for health and drug coverage. Or if they have Parts A and B with additional coverage, they can get a Medicare Advantage plan, an MA only, or an MAPD plan. They also have the option of a Medicare supplement. Part D prescription drug coverage. Regardless if you take medications or not, it is highly recommended that you purchase a PDP plan. There is a late enrollment penalty for not having credible prescription drug coverage with Medicare. You can purchase a standalone plan if you'd like with Medicare or your Medicare supplement plan. Plan premiums vary from carrier to carrier, and you can roll in a Medicare Advantage plan, the MAPD plan, that comes along with prescription drug coverage. The drug formulary is the list of medications that are covered, and it's going to vary from carrier to carrier. So make sure you verify that your prescription drugs are covered by the prescription drug plan that you choose. So the standalone Part D premiums change from plan to plan and based on your income. The National Standard Part B premium for 2023, when eligible, is $31.50. Beneficiaries are responsible for the cost sharing in the form of copays, coinsurance, and deductibles. The standard Part D deductible for 2023 is $505. Coverage varies from plan to plan. Take a look at the graph on the right to see what your Part D premiums would be based off of your income. The Part D late enrollment penalty. The late enrollment penalty of 1% multiplied by the National Standard Part D premium when first eligible, which was $31.50 per month, the beneficiary goes without credible drug coverage since first eligible. This is important. You want to make sure that you have some credible prescription drug coverage when you get onto Medicare. Otherwise, you will incur a monthly late enrollment penalty that will build up until you actually get credible prescription drug coverage. Mr. Smith misses his IEP at 65 and goes without drug coverage for 10 months. Mr. Smith will be responsible for $31.50 times 10%, which equates to $3.15 plus the monthly premium each month. If you qualify for low-income subsidy or extra help, you are not subject to this penalty. Part D exposure and coverage gap. In 2023, the annual Part D deductible is $505. There is the initial coverage limit in which you and the insurance carrier will help pay for the prescription costs. But the total cost of the prescriptions gets added up. That total cost is what we're going to be looking at. The initial coverage limit. The beneficiary pays their share of the cost based on the specific plan's benefits until they hit $4,660 out of pocket. Once you've reached this, you've hit the coverage gap, or better known as the donut hole, where the beneficiary pays 25% of the retail drug price until they hit $7,400. Then you go into stage 4, which is called catastrophic coverage. The beneficiary pays 5% of the drug cost at this point, or the designated $4.15 copayment for generics, or $10.35 copayment for all other drugs, whichever is greater. I'd like to thank you for watching our Medicare 101 presentation. I hope it was informative and educational. If you have any questions, feel free to reach out.